Joining me now is the co-founder, Communal Health Support Scheme, Dr. Akinwunmi George. Good morning.
Good morning.
Thank you for joining us on the show this morning. So the event is going to be marked on Sunday, the 28th, and we gather that the theme is finding the missing millions. For you, for your group, how easy will that be? It's like the onus has shifted to the practitioners, to the governments to find those who don't know they have this disease.
Thank you very much for having me on the show. Okay, so the event is going to take place tomorrow, the 27th, on Saturday. So our aim is to try and create awareness, to try and bridge the gap in the healthcare system, make people know more about hepatitis and how deadly it is in itself by creating awareness, by providing treatment options and also vaccinations for them.
All right, so you're going by this now using a loud, what vehicle are you using to drive this message?
So how we are driving this message is by our organization, which is consisted of a group of volunteers, medical practitioners, and other healthcare professionals. The aim is to go into these communities as a whole and create the awareness, make them know more about hepatitis, make them understand that there's a way out. There's something that can be done about hepatitis.
And we have the B and C variations common in Nigeria. Is it so because it doesn't manifest like other diseases, coupled with the fact that there's a low awareness? What is it about hepatitis B and C?
Okay, the thing about hepatitis B and C is that so some people call them the silent killers. Why? Because they do not manifest up until about when it's too late for anything to be done. So most people actually find out incidentally. Maybe they go for a general health checkup and they find out that, oh, I'm hepatitis B or C positive, and they look confused and they're like, why? But they now try to retrace their steps to find out, oh, how did this happen? So yeah, it is not something that manifests itself.
All right. So let's quickly address, prevention and treatment.
Yes. So the best possible way of prevention for hepatitis B and C, for hepatitis B, is vaccination.
Is that available?
Yes, it is readily available. And for hepatitis C, there's no vaccination, but there's treatment. There is a cure for hepatitis C. There's no cure for hepatitis B, but there are drugs, there's treatment. It can be managed appropriately.
All right, Dr. Akinwunmi George, co-founder, Communal Health Support Scheme. Thank you for your time.
Thank you very much for having me.